I'm Dr. George Vetrovec at VCU Medical Center in Richmond, Virginia, and my topic is on the benefits and use of hemodynamic support in high-risk coronary intervention. It turns out that if one reviews the patients we do for standard coronary angioplasty, there are two groups of patients who potentially benefit from hemodynamic support. These include patients with significant impairment of left ventricular function, and I think sometimes we're surprised at the actual incidence of those patients that we see, particularly in the surgical turn-down patients. And there's also the group of patients who have cardiogenic shock. And one of the issues about cardiogenic shock today is that we've really gotten it right in terms of door-to-balloon time, and there doesn't seem to be a lot of opportunity to improve that. So whatever we can do with our interventions to preserve heart muscle by decreasing myocardial oxygen demand has a good potential benefit. Now, in terms of our goals of hemodynamic support, they are to give more time for the operator to get better revascularization rather than a hit-and-run strategy, and to provide, as I noted above, reduction in ischemia, particularly in the setting of cardiogenic shock. In both cases, we're trying to stabilize the patient in terms of blood pressure, myocardial blood supply, systemic perfusion, and in particular, give the operator time to be comfortable in doing the necessary procedures. Now, there is growing evidence that better revascularization is associated with better outcomes, which may be a very important reason to give the operator time to do the best total revascularization. Recent study evaluation from the Acuity trial suggests that in those patients who have complete revascularization with the least residual ischemia based on coronary anatomy after the intervention, have overall the best outcome in terms of mortality, recurrent myocardial infarction, and even major adverse coronary events. So this significantly supports the concept of better revascularization. Now, if you look at the literature and particularly the guidelines today, there is growing acceptance of various categories in which hemodynamic support is seen as beneficial in terms of patient management. And I think the real focus from an interventional standpoint are in the two groups that I noted: patients with severe left ventricular dysfunction and patients with cardiogenic shock.